Radiomed introduces the newly released VisicoilMR Platinum Linear Fiducial Marker. The VisicoilMR is engineered with enhanced materials allowing for visualization with all imaging modalities including MR, enabling you to target tumors with greater convenience, confidence, and efficiency. Because gold and platinum have nearly the same high radio densities, both are seen and tracked by X-ray-based imaging. The platinum, with a greater magnetic susceptibility as compared to gold, allows it to be visible under all the same imaging modalities as gold markers, but it also has the added benefit of being visible under MR imaging. The VisicoilMR is shipped to you in a sterile, ready-to-use package, saving valuable procedural time, with the marker preloaded at the tip of a pre-waxed introducer needle. The patient is usually placed in the lateral recumbent position with the knees as close to the chest as possible. The transrectal ultrasound probe, or truss, is then inserted into the rectum and the prostate is confirmed at the tip of the probe. Maintaining sterile technique, open the package and remove the needle and protective tube. The needle containing the preloaded VisicoilMR is then inserted into the probe's channel and is advanced into the target tissue. Remove the stylet lock securing the stylet at the hub of the needle. Gently advance the stylet inside the needle until it contacts the VisiCoil. The marker is now ready to be deployed. For a linear deployment, this is done by securing the stylet with one hand and while gently rotating the needle hub, withdrawing the needle with the other hand until it contacts the stylet handle, thus laying out the marker and not pushing it out. At this point, rotate the stylet handle after deployment to ensure the marker and stylet separate. Finally, rotate the needle assembly as it is retracted from the patient. After the position of the first VisicoilMR is confirmed, the procedure is now ready to be repeated with another VisicoilMR. Once placed, VisicoilMR's helical design provides 360 degrees of surface area for tissue adhesion along the entire length of the coil. This translates into exceptional marker stability from implant through treatment. Similarly, the VisicoilMR with its enhanced texture can also be inserted into breast, prostate, liver, pancreas, mediastinum, vaginal wall, cervix, esophagus, or other soft tissue. Most treatment equipment allows for the marker to be contoured for tissue location and position. Another method is to use the endpoints, or points along the marker, for reference and localization. VisicoilMR's linear design offers more location information from only 2 needles, compared to typical solid gold markers requiring a minimum of 3 needles, often larger in size. Because platinum's characteristics allows less material to be used in each marker, the decreased marker size allows it to be delivered in a smaller gauge needle as compared to gold markers, increasing patient comfort. VisicoilMR fiducial markers are offered in needles from 18 gauge to as small as 22 gauge, and needle lengths of 8, 15, or 20 centimeters. The marker diameters are between 0.35 millimeters and 1 millimeter. The newly developed VisicoilMR linear markers offers you the advantage of visibility across multiple imaging modalities, including MRI. Additionally, it offers multiple reference points per marker by selecting the endpoints of each marker or contouring the shape of the marker. This translates into less needles for the patient. Together, these features may improve patient comfort, reduce patient bleeding and edema, as well as shorten procedural time for implant. VisicoilMR is FDA cleared to radiographically mark soft tissue for future therapeutic use.